All right, good morning, everyone. This is my second speech for Columbia College of Missouri. I'm going to be talking about high blood pressure this morning. All right, when you associate high blood pressure, do you automatically associate it with somebody being overweight or old? Many Americans today suffer from high blood pressure, even if they're old, skinny, young, or fat. Many people go years without even knowing that they have high blood pressure. This morning I'll be talking about some of the ways of detecting high blood pressure, preventing it, and treating it. High blood pressure damages blood vessels, and this can cause things such as stroke, heart disease, kidney failure, and heart attacks. All right, I've mentioned some of the risks so far. Let's talk about the detection of high blood pressure. When you detect high blood pressure, you're going to first thing you want to know if you determine if you have it or not. And a good way of determining if you have it or not is just going to your local healthcare facility and actually getting checked for it. So high blood pressure is it's not no signs or symptoms for it. Like I mentioned before, you can go years without even knowing that you have high blood pressure. So when you go to get tested for high blood pressure, the doctor's going to use one or two things. He's going to use a sphygmometer, which is the manual way of taking your blood pressure, or he'll just use the new electronic instrument with the digital readout. And that's most preferred. And this morning I actually went to go get my flight physical and had the electronic one and wound up having like high blood pressure with the electronic one, so they did it manually, and it actually gave like a better reading for me. So it actually worked out using the manual. So if you ever have problems, just tell them that you want it to be tested manually instead of using the electronic if you're having problems. So we talked about some of the detecting. The best way to detect it is actually just going to go get it checked and tested at your local healthcare facility. Let's talk about some of the prevention that you can do in order to keeping your blood pressure low. First thing you want to do is you want to maintain a healthy lifestyle, and maintaining a healthy lifestyle is things such as eating right, exercise. Studies have shown that if you maintain like a good healthy eating diet with foods like rich in vegetables, fruits, and low-fat dairy products, then this helps your chances of keeping your blood pressure low. Also recommended is whole grains, poultry, fish, and nuts. These are also good foods to eat if you're trying to prevent high blood pressure. Next thing you want to do is kind of maintain a diet that's low in sodium. The National Heart, Lung, and Blood Institute recommends that we should keep our sodium intake down to 1 teaspoon a day. So it's kind of hard, like people for me, I'm from the South, so I'm used to being brought up on foods that are high in sodium, fried chicken, and stuff like that. So I gotta train myself to eat better to keep my blood pressure low now, since I'm actually getting older. Next thing you want to do is you want to exercise and be physically active. The American Heart, or FamilyDoctor.org, actually says that if we exercise for 30 minutes a day, not really exercise, but be physically active for 30 minutes a day for most days of the week, then we should, this will help our chances of lowering our blood pressure. Being physically active doesn't mean that we got to go out and run 5 miles or anything like that. It just basically says, just be physically active, go out and wash your car for 45 minutes. All that activity, helps keep your blood flowing. All right, we've talked about ways of preventing high blood pressure. Now let's talk about some of the treatment. The National Heart and Blood Institute, along with many other websites that I've researched, recommends that your treatment goal for blood pressure is actually 140 over 90. And 140 over 90 is meaning the first number is your systolic, and the second number is the diastolic. And the systolic is basically the highest pressure from the peak when your blood is actually pumping out the heart and all. And the diastolic is basically the rest in between the beats and the blood is being pulled back to your heart. So you want to try to maintain a 140/90 and below. If you're having problems, if you're maintaining a healthy lifestyle, you're eating right, you're doing physical activity, and you still have high blood pressure, then you may have to take medications. If you go to the AmericanHeart.org, they recommend a lot of medications that you'll be able to take in order for you to lower your blood pressure, along with talking to your physician about what suits you the best. All right, this morning I've talked about some of the detection, prevention, and treatment of high blood pressure. Hopefully, if any one of you have been suffering from it, then or don't even know that you have it, just go get treated or go get tested, and hopefully this will help you out with the subject. In conclusion, I want to thank y'all for being here, and you guys have a good day.